Coronavirus. How worried should we be? A virus, previously unknown to science, is causing severe lung disease in China and has also been detected in other countries. People are known to have died, and the outbreak shows no sign of stopping soon. A new virus arriving on the scene, leaving patients with pneumonia, is always a worry, and health officials around the World Health Organization has declared a global emergency. How severe are the symptoms? It seems to start with a fever, followed by a dry cough, and then, after a week, leads to shortness of breath and some patients needing hospital treatment. The World Health Organization says data from 17,000 patients suggests 82% have mild disease, 15% are severe, and 3% critical. Notably, the infection rarely seems to cause a runny nose or sneezing. How deadly is it? While the ratio of deaths to known cases appears low, the figures are unreliable. It is far too simplistic to divide the number of deaths by the number of cases to calculate the death rate to get a figure of around 2% at this stage of the outbreak. Thousands of patients are still being treated, and we do not know if any of those cases will die, so the death rate could be higher. Many of the early coronavirus cases were linked to the South China seafood wholesale market in Wuhan. SARS started off in bats and then infected the civet cat, which in turn passed it on to humans. Two reasons: people coming into close contact with animals harboring viruses, and dense urban populations that allow it to spread. When are people infectious? Mostly when people are coughing. However, Chinese scientists have suggested some people may be infectious even before their symptoms appear. The time between infection and symptoms, known as the incubation period, lasts up to 14 days. Are there any vaccines or treatments? No. However, the work to develop them is already underway, and it is hoped there will be human trials before the end of the year. Can summer save us? Colds and flu tend to do their main business in the winter months, so there is hope that the turning of the seasons may help stem the outbreak. How can I reduce my risk of being infected? The World Health Organization has the following advice, which apply to many other respiratory diseases too. Wash your hands, as soap or hand gels can kill the virus. Cover your mouth and nose when coughing or sneezing, ideally into a tissue, and wash hands afterwards to minimize spread. Avoid touching the eyes, nose, and mouth. If your hands touch a surface contaminated by the virus, this could transfer the virus into your body. Don't get too close to people coughing, sneezing, or have a fever, as they propel small droplets containing the virus into the air. Ideally, keep 1 meter away.